leading orthopedic surgeon from India, shares his education and experience. He has experience and training from India, England, Germany, the U.S., Switzerland, Australia, and Singapore. He also talks about the use of stem cell therapy in orthopedics.
I trained in India, in Gujarat, most of my primary and postgraduate training. And then subsequently I went to England, worked in Oxford, the Nuffield Orthopedic Centre there. And after a few years in England, and came back to India, went back to Germany and worked there at Klinikum Karlsbad, which is a centre well known for spinal surgery. Following that, I've done various fellowships in England, in America, in Switzerland, Australia, sometimes between 2 to 6 months spent in various places of the world. So I think I'm adequately trained, and I've been practicing now for a very long time. I've got a huge number of patients whom I've operated, which include spinal surgeries, joint replacements, revision joint surgeries, revision spinal surgeries, correction of deformities, etc., apart from the routine trauma. The publications which I've done, they are on spinal surgery that we have done, two of them when I used to work in Oxford. We came out with 2 papers, one on spinal canal stenosis, the other on the genetic correlation in scoliosis with patients' relatives, including their parents and grandparents. So we took blood samples and we tried to correlate that. Preliminary results are very exciting, especially in the area of spinal fusions. I understand now all across the world there would be about 3 to 15,000 cases. The exact numbers are not known, where totipotent cells or mesenchymal stem cells are used. We have now done in the last 1 month 15 cases. We've done it for spinal fusions, we have done it for avascular necrosis, and also for bone gaps, which are non-unions. The initial results are very encouraging. However, before we can come to any statistical, unbiased report, it would take us some time, maybe a couple of months before we come out with our results. It is the largest center outside United States today carrying on stem cell therapy. We are using mesenchymal stem cells. These stem cells are isolated from the iliac crest. So you put in a needle and collect bone marrow and then centrifuge it, and there is a kind of membrane through which you pass the centrifuge, and you get a buffy coat which is full of mesenchymal stem cells. These stem cells are then injected into the site where you want the union or fusion to occur. And when you put it into that site, they get converted to osteoblasts, which will give rise to new bone. And it's the patient's own stem cells, so there is no question of a reaction. The amount of blood that we need is slightly over 100 mL, which is also a small amount, and we take it from the patient's own iliac crest. There is no incision, it's just a small needle that goes in. So it's actually a much better technique. The other alternatives where we take out the patient's bone grafts, and that would lead to patient having a lot of pain at the site of bone graft. The other alternative was to use bone morphogenic protein, also called as BMP. Now, bone morphogenic protein is something that works very well, but the only drawback is that it is an extremely expensive proposition.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote and more information.